So today we have with us Ashall-Payne, CEO of ORCHA, world's leading healthcare app review and advisory organization. This will give us an overview of the best apps that help us fight the current COVID-19 pandemic and its consequences. So Liz, thank you for being with us here today.
Thank you.
So your organization reviews health and care apps to help the public and professionals use the most relevant ones, as well as provides guidance to app developers to help them improve their apps. So Liz, in the current situation of an unprecedented global pandemic, what different benefits the mobile apps can provide to public health authorities, professionals, and public itself?
Yeah, of course. Thank you for interviewing me this morning. It's a pleasure to be here. As we all know, countries, the world at large is having to self-isolate and reduce social interactions in order to support a flattening of the COVID crisis. However, the crisis is quite significant, and what we're seeing is healthcare systems needing to react to that crisis from a frontline perspective to support the most critical cases with ventilation and support in an acute setting. What digital health can really do to support is to support vulnerable communities who are in their homes, who may have a condition, who may now need to self-manage in a way that previously they were able to access support from the healthcare system. And what we need to probably do in relation to that is really support those people to be able to reduce their risk of having a crisis with their long-term condition. And I'll give you an example. So I actually live with type 1 diabetes. Now, obviously, previous to this crisis, I was able to access my primary care physician, a diabetologist should I need it, screening, etc. And right now, obviously, the healthcare system is directing resources to the crisis. And so what I need to do is really look after my health so that I don't have a crisis for my long-term condition. And we also know that people who are in those vulnerable communities are at greater risk of having a more significant impact if they get COVID. Now, obviously supporting those vulnerable communities is one arm. And what we also know and what research tells us is that there's going to be a significant impact on our society's mental health from the crisis, either be it from self-isolation and quarantine, or be it for the frontline healthcare workers who are dealing with the crisis right now, or for patients who've experienced challenges as a consequence of the crisis. And so in the same vein that we need to flatten the COVID crisis, we need to flatten the mental health curve. And then the third area, which is really coming to its own, is online consultations. So what I've talked about are solutions that can support people's long-term conditions, physical health and mental health. But obviously, primary care has now completely changed how it works. Most people now experience primary care from a perspective of having a video consultation. Now, what we're doing is we're working with those video consultations to also embed the prescription of digital health solutions at the end of a teleconsultation for patients that they're seeing. And actually, just one final thing, what we also see globally are ministries of health looking for tracking apps for COVID. So how can we track and understand the disease and the impact on our population's health? And so that's the backdrop to why digital health can support COVID.
Yes, thank you. So the wide range of conditions and situations, basically. But what we have also seen since early March is more than 500 apps containing coronavirus-related keywords, according to your accounts. And just very recently, your organization has launched COVID-19 Health App Formulary to help healthcare professionals and consumers know which health apps they can trust. So, in your view, can you give us, can you give us a brief overview of the best apps that you have evaluated that really deliver value to tackle the COVID-19 pandemic?
Yeah, absolutely. Just to give a little bit of backdrop to why we've done this. So you're absolutely right. There are literally hundreds and thousands of digital health products available to us. Apple App Store and Google Play are filled with health, fitness and medical products. Our research in the past has shown that only 15% of all those products are actually high quality and safe. And what that means is that if you're an end consumer, or in fact a healthcare professional, and you go to the App Store, you've got a greater risk of finding a non-quality product than you have of finding a good quality product. And so the COVID app library has been put together, and it's founded on a review of these products. And I'm going to share my screen with you so you can see what that looks like. So before I show you the app library, just to say that these are the range of conditions that we've identified as being able to support the COVID crisis. So you can see it covers those areas that I've just mentioned around long-term conditions, mental health, online services, and obviously COVID-19 specific products. Now, when you go to the app library, and this is a free resource, anybody globally can come to this, it's covid19.orcha.co.uk. You can either enter a keyword search, so say for example I'm feeling anxious. We know that actually anxiety is the highest search term in this library already. You'll get a range of suggested words. You can hit anxiety and immediately you will get a list of products. Now, what you'll see is that these products are rated with a percentage score. The percentage score is very, very important, and we always put the highest rated product first. You'll also see that there's this little blue box here which states that this app can support COVID-19. To get more information, you simply click on that card, and what you'll be able to see is more information about how that product can benefit and support COVID-19, what, if any, implementation requirements are required, any links to case studies and references, and any change in pricing as a consequence of COVID. There's further detail about that review. So under data privacy, you can see all the areas of assurance, clinical assurance, and under user experience. And if you want to download the app, you simply hit download. Here you can go straight to the Google Play, or if you're on a laptop like I am, you can use the QR code using your mobile phone. Now, the question that you asked me was, which is the best products? And it's an interesting question because there is no one best product. And I'll give you an example. So we've here searched for anxiety. Now, depending on different personal preferences and needs, that will depend on that will then indicate that you may need a different product. So if I'm a teenager coming to this site and I have anxiety, or if I'm an adult with anxiety, or if I'm a young child, immediately you know there that the product that you'll need will be different depending on your personal preferences and needs. And so when you come to this site, it's not just about getting a long list. There's also the opportunity to filter the search. So I just talked about an age range. So equally, if you're a clinician and you're trying to find a product to help you support people with anxiety, your needs will be different to that of an adult or a child. Equally, you might be specifically searching for specific functions and features. The country of origin may be relevant to you, and equally the cost may be relevant, plus obviously the platform. So if you are an Apple user, an Android user, or in fact you want a web-based solution. And so by using the filters, what that means is you're not just getting a list of good quality products, you're able to find the best product for you as an individual.
Liz, thank you very much for your insight and for all the work that you've been doing. And thanks a lot for being with us today, and looking forward to seeing you somewhere in the future.
Thank you very much for your time.
Today we have with us Andrej Studencan, CEO of STEMI, mobile application successfully deployed in Slovak healthcare that prevents unnecessary time delays in patient management, connecting emergency medical staffs and hospitals, aiding dispatch of patients suffering from heart attack, stroke, or trauma, the right point of care, saving precious time these patients need. Andrej will talk about his experience on how to successfully implement the health app from the perspective of app developer. Andrej, thank you for being with us today.
Thank you, it's my pleasure.
So Slovakia is a country with one of the best responses to COVID-19 pandemics, still keeping the curve flat. And in response to the COVID-19 pandemic, your company have enhanced the STEMI technology beyond the heart, stroke, and trauma by creating a new COVID-19 module. So Andrej, can you please tell us more about how this app works?
Definitely. It's correct. Slovakia has implemented various strict measures, and it did relatively quickly compared to some other countries. And as a result of this, it is true that the COVID curve hasn't been exponentially growing in Slovakia, which is good. It even began to develop its own tracking system. Most of these measures, however, have focused on protecting ordinary people, like you and me, for example, which is good, but there is also the need to protect completely another group of people, which from a certain point of view is even more important. These are the people standing in the front lines, and I'm talking about the medical staff in hospitals. If significant numbers of these people become infected, there is a chance that the whole medical system can fail, and this would bring catastrophic results for everyone. So I believe that this is the area where Slovakia, as progressive as it has been so far, has some gaps, and I'm quite sure that many other countries do that as well. You know, it's not uncommon that, for example, there is an acute patient who arrives to the hospital with ambulance. This can be a patient suffering from heart attack, stroke, or severe injury. And the problem is that only after the arrival to the hospital, it turns out that the patient is actually infected or suspected to the COVID-19 infections. So what happens then is that all the hospital personnel become suspected themselves as well and need to go to a quarantine, not to infect others. The whole team gets basically paralyzed, and during the present emergency, they need to specially dress, and it prolongs the treatment time of the acute patient. So there is another negative side benefit of that. Just recently, in one of the smaller hospitals in eastern Slovakia, there was a patient suffering from stroke. It turned out that this patient is suspected or infected by COVID-19, and approximately 70 employees of the hospital needed to go to the quarantine. So you can imagine how serious that can be. So the solution is very simple. It is the solution we are after. Basically, paramedics need to inform the concrete particular hospital team in advance that the patient they are bringing is a risky patient. And as you rightly mentioned, we have developed a communication platform called STEMI, which connects emergency medical teams in the field from those in the hospital. It's used for the management of acute cases such as heart attack, stroke, or trauma. And it is used for exchange of critical clinical data and information about the patient. As a result of this remote consultation, good decisions can be done about what's going on with the patient and what is the best place to take the patient so that we minimize the treatment times and avoid secondary transplantations. And having this infrastructure in place, basically all over Slovakia, there are 300 ambulances plugged into our platform and approximately 60 hospitals. So we said after the pandemic broke out, why not to use this infrastructure that's already existing to protect the personnel in the hospitals. So what we did is that we inserted in that workflow a COVID-19 checklist. So as a part of the consolidated information being transferred from the hospital, from the ambulance to the hospital, there is also a COVID card indicating the riskiness of the patient of having COVID-19. So the hospital is informed in advance. They can properly prepare in advance and be alarmed in case it is needed.
So Andrej, thanks a lot very much for your insight here today. I'm wishing you lots of success, and thanks for having us here, for being here with us today, and looking forward to seeing you sometimes in the future with White Summits.
Thank you very much. It was my pleasure.
Talking to us today is Rahel Anne Bailie, Director of Content at Babylon Health, UK's leading digital healthcare service, who will talk to us about the importance of content modeling, including do's and don'ts. So Rahel, thank you very much for being with us today.
My pleasure.
Can you tell us a bit more about what content modeling is and how it can help us develop and implement effective apps to fight COVID-19?
Oh, for sure, yes. So content modeling is simply a way of identifying content. So first of all, and most basically, content can be identified by its structure. So for an example, an event can have an event name, date, location, start time, and it can have all sorts of other identifying structural elements. But if there was only an event name, it's not an event, it's an article. So you know what an event is by the content elements it has to it. So it's a way of identifying content. And secondly, and most importantly, content modeling helps content be identified by intent. So as a simple example, if you search for headache, Google will present you with articles on the topic. But if you want products, Google will show you headache remedies that you can buy. And if you want news about headaches, Google can show you only news articles. So how does Google do that? They don't actually. The onus is on the content producer to show the intent of the content. And how you do that is through content modeling. So you might say, well, what about when the content is not on the web, but it's in an app? Because we're talking mostly about apps. Well, it's a similar thing for app strings, Q&A sets, so on. You still need to indicate what your intent is, but you're not indicating it necessarily for Google, but you're indicating it as a way to automatically deliver content and deliver it into the app, or deliver it to the people who need to know that you have that content. And how many organizations are we creating duplicates and triplicates of content, sometimes that contradict each other because they don't model the content in the first place, and so you don't know that it exists and you recreate it. So in the content industry, there's this concept called intelligent content. And the content, that concept that was created by Anne Rockley, who we call the mother of content strategy, it intends for content to be automatically delivered where it's needed. So content's not something that's kind of baked by hand. We're talking about a production house of content here. So when you build an app, it's like building the bakery. And when you build content, you're the person that's baking the muffins over and over again every day. And so you need to operationalize your production so that you can deliver the goods into the bakery reliably, like on time with predictable quality. And if you talk to content people, they'll tell you that sometimes the app in the front end looks beautiful, but it's a mess in the back end because they haven't modeled the content, they haven't invested in content tooling that can recognize the content models and so forth. So all of this is kind of tied together, and content modeling is often the forgotten piece. They buy a tool, but then they don't model the content. And so when you're saying, what do we have about COVID, for example, who knows? It's out there somewhere, but we have no way of retrieving it.
So, and in the regard of the COVID-19 pandemic, so do you think there are any specifics that should apply, or anyone building the content for whether it's the web or app? What should they have in mind in terms of the good content model that can cope with the infodemics, for instance, we have with COVID-19?
So you, as an organization, you probably have a lot of information about COVID-19, because if you are serving up, whether it's on an app or a website, and you need to get your hands on it quickly and reliably, and that goes for any pandemic or other situation, of course. But when you have this information about COVID-19. So first of all, you need to have a taxonomy, and that taxonomy needs to have a node for COVID-19. And then you have to be able to tag your content with COVID-19. And you have to be able to tag your content, not just with COVID-19, but the country you're talking about, the population you're talking about, maybe the underlying health conditions or the audience. Is this for a medical audience or for a public audience? And you need to be able to vary the content slightly to suit all that, but you still need to be able to manage it efficiently. So if you model your content in that way, that you can identify the pieces of the content, the structure of the content, the topic, COVID-19, the attributes, so medical versus, or clinical versus public, or industrial versus personal, or this country versus that country. All of those things are going to allow you to create content more efficiently, manage it more efficiently, deliver it more efficiently, and then pull it into whatever app or website that you're using more efficiently.
Mm-hmm. Great. So when we take it further on the practical terms, if you were talking to any app developers, what will be your advice on do's and don'ts on the content modeling?
Right. So the big don't is do not, under any circumstances, hard code content into your app. Those days are long dead. What you want is to have a good content operations model from the get-go. So just the way organizations rack up technical debt, they also rack up content debt. And then nobody wants to take the time or energy to go back to reduce that debt. So really, you need to start from the beginning. So start and think about, what do we want this to do, and how do we have a content operations model? Because if you think about, I often use the example of Netflix. Netflix is technically a video streaming company. It's a technology company. So they have an app called Netflix that's used to download things. But when's the last time that you went to compare download speeds between Netflix and Amazon Prime and then made a decision on that technology based on the download speed? You know, that 0.003 milliseconds. Nobody. You go there for better content. You perceive that there's better content for you. And the same thing with apps. The perception of the user is that this is a better app or a poorer app because of the content. And they don't even really think about all the technology that's behind the scenes. They just think, this is giving me better answers or more accurate answers. And so what you want to be able to do, and especially in a COVID-19 situation where you have rapid changes, it may change twice a day, you know, the advice from the government, or you know, they've made some sort of medical breakthrough, or do you wear masks or not masks? And you have to be able to respond to that very quickly. So you want your content operations to be able to kind of, you know, using that bakery model to bake your muffins. You want to be able to just like throw muffins in the oven, have it done right now. And so you need to have your content modeled and stored and deliverable in a very rapid way, in a very agile way. So to do that, you need to listen to the content people, because they know the pain points. Everyone thinks the pain point is down at the delivery end. It's not. It's at the authoring end, and it's at the translation end. And it's, you know, to fix those things, you have to fix the model. So, and content people may not be able to express those pain points, but if you listen between the lines, you'll see where the pain points are, and you'll see that, aha, we need to fix it up here, and then all these other pain points will fix themselves.
Great, very insightful and very to the point, I think, in these times. So Rahel, thank you very much for your time. It was great talking to you today, and hopefully hope to see you in the future in some of the Y Summits, webinars or summits.
All right, thank you.
Thank you. We're moving over to the line.
Okay, great.
Okay. So now I'm here with all the speakers from previous sessions, with Andrej Studencan, Rahel Bailie, and Ashall-Payne for the live Q&A. And so far, we don't see any questions popping in. So perhaps maybe first question for me, and that'll be to Liz, but of course anybody else on the panel can add their view. So this, in ORCHA's assessment sheet, we find percentage scores for data privacy, clinical assurance, and user experience. Given your experience, and you told me in the interview as well that only 15% of the apps overall, they meet some quality criteria, but which of these areas that you assess, also from the user's perspective, to see on your webpage, which of these areas, data privacy, clinical assurance, user experience, tend to be most overlooked by developers?
Yes, I mean, it's a really good question. It depends, actually. So it normally depends on the background of the product and where the product developer is coming from. So if you take, for example, a doctor who has found a problem that they feel could be supported with a digital health solution, what you'll probably find is that the clinical element of that product will be very rich, and that's because their knowledge base is founded in that area of expertise. However, the complexities around data privacy, data security, interoperability, consent, authentication, verification, and the whole load of standards around that area will be less familiar to them because their background is one of medical as opposed to data. Equally, if you find that a product's being developed by somebody on the technical side, you may find that they've overlooked some of the clinical requirements. So what we tend to see is there are gaps, and that's because it's confusing, and that isn't anybody's fault, by the way. There's about 2,500 standards and best practice that could be applied to a product. So for somebody to know about all of those standards would be a real challenge. And so what we do is we apply the standards to the product and then critically providing improvement reports that then support the developer to be able to know which and where they have gaps.
Great, thanks. And maybe we also have Andrej Studencan from STEMI, and we know, Andrej, that you collaborated with your father when you were developing the STEMI app, and it's known that your father is a cardiologist who helped you with a lot of aspects on the medical side. So in retrospective, what would be your advice now to overall the app developers, and having heard what Liz offered in her view?
Well, I generally come to the conclusion that you need to have right people, right places. Everyone has their capabilities that can offer. For example, in our case, me personally, I'm an economist, I'm a project manager. I would probably be never able to identify that gap on the market and that need in the medical world that my father was able to do, having his more than 30 years of experience dealing with acute myocardial infarction cases, you know. So in this particular concept, it was a nice cooperation. He came with the idea, he came with the need, he understood and help in the logistics and the management of acute patients. Me and my brother, who are more in the business world and media world and marketing world, on the other hand, were able to take his idea and make something tangible out of that, and make it moving and transform it into a real product and a real startup and a real company. So I think it's very important to understand what your limitations are, what your boundaries are, and what is the value that you can really contribute.
Great, thank you. So I see one questions arriving in our chat here, and perhaps maybe turn out to Rahel here. What are the sort of validation requirements for, in this regard, healthcare apps prior publications? Maybe that you would be your advice here on the requirements before.
Well, you know, when you talk about validations, you kind of, my mind automatically goes to things like compliance checks and so on. So you need to have clinical safety, and you know, sometimes if you have a medical device, this is required anyways. But even if you don't have technically a medical device, it doesn't do your patients, your customers, any favors if you're not validating medical safety. So that's like number one importance. There's regulatory compliance, there's clinical safety, and there's legal and editorial. So if you think about apps, what customers are seeing is content, and they're not thinking about the way the code has been factored in the background and all of those things. They don't even really have that consciousness for the most part that this is what's going on in the background. They see content. For them, it's some sort of a web, that's what they think, or that's some sort of an app. They don't really think about the background, but they judge everything on the quality of the content. So you've got those validations that you need, clinical safety and compliance and so on. But you've got as well, you need to have editorial sign off, because you need to have, it has to be relevant, accurate, timely, engaging, and it needs to be standards based. You need to be able to access it. For example, if you think about people who are deaf, people who are blind, people who might use a screen reader, have you designed your app so that everyone can use it? This is not a niche product. Generally, it's a product for a great range of people, many of them with health conditions, so they have to be able to use it if they're using a screen reader, or if they have, if they're quadriplegic and don't have, they've got some adaptive measures. So you've got the whole accessibility aspect of it, and plain language. Not everyone can read at a high level. Not everyone has English as their first language, or whatever language you're developing it in. So they need that information presented in a very basic way, in multiple ways, in, can they listen to it? Can they have it read out to them? All of those things that you have to think about. And that adds a layer of complexity to the development, not just of the content, but of the app itself, to be able to, because design and content work so inextricably. And of course, the technology has to be able to serve all that up.
Great, thanks. I think we all agree that user experience is key, and actually that's the end game of it, when the users download the apps and see how easy they are used, and how easy they are to use, and understand the overall benefit of them. So Liz, Rahel, and Andrej, thank you very much for your time and for being here with us today in our live panel. If we see any, thank you. And if we see any further questions coming up, we'll be gladly forwarding them to you for your offline answers that then will be posted to our participants. So thanks a lot, and great to see you again.
Take care.
Thank you very much. Bye-bye.
Bye.
Bye.